Good afternoon, everybody. My name is Brian Hadeed. I'm a general dentist in Clinton Township, Michigan. The date's April 1st, 2020. And today I want to talk to you about aesthetics. Okay, all kidding aside. I want to say this. I'm going to talk about the subject of teeth whitening. What teeth we can whiten and what teeth we can't whiten. I'll get right to it. A lot of times patients come in and they say, hey, can you make my teeth whiter? I don't like how this tooth looks. I don't like how that tooth looks, or all of these teeth. We can make your teeth whiter pretty much regardless all the time. The question is how we're going to do it. For a natural tooth with all natural tooth structure, generally speaking, we can get a good effect with traditional whitening techniques, such as making models of your upper and lower teeth, giving the patient some soft trays, if you will, to take home and wear for 15-20 minutes a day, an hour a day, depending on the formulation of the peroxide that we give you. And you put a little peroxide in the tray and you wear these trays, okay? So a lot of people are familiar with that technique. It's really common. It's probably the more easy way, one of the easier ways of doing it. Now, here's the caveat to all that. If you have teeth that you want whitened, and these teeth are heavily filled with white filling material, and you can see the white filling material on the surface that you want to be whiter, those white fillings are not going to whiten. Just the same, if you have a tooth that's crowned or capped or veneered with ceramic from a dental lab, or from a dental lab, those teeth aren't going to whiten either. We can get them whiter, but what we got to do is replace the ceramic veneer or crown and make a whole new whiter, more translucent, if you want, crown or veneer. For the teeth that are heavily filled with white filling material, the only way we're going to get those teeth whiter is replace the filling material with a lighter filling material. However, I'm going to say something about that. I'm not a fan of doing that. Very often what happens is, even if you use a whiter filling material, that tooth still, and that part of the tooth that's filled, still doesn't look as white as the patient wants. And the reason is because that filling material really tends to, especially the modern filling material, really tends to take the color of the adjacent tooth structure. So if the adjacent tooth structure is pretty dark, and it usually is, the white filling materials tends to seem a little darker. So in those cases, not always, but generally speaking, I'm still going to recommend crowning the tooth or veneering it. So that's the main gist of teeth whitening. Another little point is regarding a situation in which a tooth's dark or has become really gray. Maybe just say one tooth next to a bunch of other teeth. Lots of times that happens because that tooth had been traumatized previously. So maybe when you were 17 years old, you got hit in the face with a basketball in a basketball game. And a couple years later, that tooth died. It turned gray, it turned dark gray. The tooth died. You needed a root canal on the tooth because it started to hurt or get infected. So that's fine. You get the root canal done, but you still have this dark tooth. In those situations, that's an intrinsic staining, an internal darkening of the tooth. No external whitening process that we do is going to make that tooth be acceptable to the patient. It's still going to look dark and gray. In those situations, I'm crowning that tooth to get it whiter or veneering it. That's it. That's all we can do. Just wanted to say that. Everybody have a good day. Keep washing your hands. Like I said, it's April 1st, 2020. I don't know if I said that, but it's April 1st, 2020. Started off with a little April Fool's joke there. And have a good day, everybody. Bye-bye. Until next time.